MP, well, tell us, what is the situation concerning dengue in Tabaquite?
Well, we've been getting a significant number of requests for spraying of areas. On Friday last week, the councillor for the Tabaquite area, Mr. Henry Awang, and vice chairman of the Couva Tabaquite Talparo Regional Corporation, started a dengue awareness spraying effort in the community of Tabaquite. We have been hoping to roll that out across the constituency. Areas like the Guaraca region, we've been inundated with requests for spraying. We've been trying to get them out as quickly as possible. But what we're seeing, I think, is just a response from citizens because they have seen the increases in the mosquito population. There is also a type of fear that if we do not get this under control, we will really become inundated further. So we've been doing a combination of community awareness, which is to clean up our communities, getting rid of any receptacles, things that can breed mosquitoes where we can within our community, but we're also heavily dependent on central government for a certain number of resources by way of the spraying issue. We've gotten word that the fogging machine, we only have one in the Caroni district. So the constituency of Tabaquite covers both the Caroni district and the Victoria Health district. And so there is no fog machine on the Victoria Health district, which disadvantages some of my communities. We're waiting to literally just borrow one from another region at this point in time. And so that is what we have been looking at as a constituency. We are taking it community by community. The issue is that it has been a slower rollout than we would have liked to see. And mind you, we've been putting in our requests as early as the beginning of the year, especially in terms of clearing overgrown bushes. We've been in conversation with Ministry of Works to clear areas within the Grand Couva area, to clear areas within the Tortuga area, because there is what we can do as individuals, there's what we can do as a community, and then there's really what the government ought to be doing to ensure the public good. And that is the part of the puzzle that we've been missing in the constituency of Tabaquite.
Yeah. MP, when we talk about an increase in dengue cases, do you have any data at all?
Yeah, and that's the other issue. Anybody that knows me knows that I, really advocate for a data-driven solution to our issues. And what we have is really just anecdotal and driven by a sense of fear. And so there is an increase in the mosquito population. There's also the flu, and that combination gives us a rise in the fear of dengue as well. The data coming from the ministry has been slow. What we do have, though, is from those persons who've done private testing and private testing spaces, reporting to us that they have been, in fact, they've tested positive for dengue. And so until we have, and we raised that in our correspondence with the ministry as well, that if we have data coming from the centralized sources of where there may be concentrated or higher numbers of dengue cases, then as we work with local government, as we work with insect vector control, we can then be more targeted in our response. But in the absence of data, we are now trying to blanket a large constituency, and it's not really the best use of resources, but it's just all we can do at this point in time.
Yeah. Now, earlier you mentioned the clearing of overgrown bushes and so on. And I'm sure that the corporation in the area would have been in touch with local government and also the Ministry of Works and Transport. Has there been any response from both ministries at all?
Yeah, the thing is, in my years as Member of Parliament, the one thing that I can tell you that I have faced is an insane level of bureaucracy, in that things that you and I personally, those of us who are citizens of Trinidad and Tobago, would consider easy fixes, that there's a drain that needs to be cleaned or a roadway that needs to be cleared. The level of bureaucracy we face as members of parliament, those of us who have to advocate throughout the system, it's incredible. And I want to in no way put the blame on the technocrats or the persons who are tasked with executing the duty. But, I had a drain that required cleaning. We sent the information up, and Ministry of Works is disputing whether it is Ministry of Works or Ministry of Rural Development. And as a member of parliament, that's a frustrating experience. But as a citizen of Trinidad and Tobago, it's simply a matter of getting the job done. And had we gotten that job done, it wouldn't be something that we would be rushing to do right now. And if we have our roadway clearing, our drain cleaning as a matter of rotation, because this is not rocket science, this doesn't require any PhD level thought process. It is really a matter that, grass will grow, the drains will require cleaning. Put it on a proper schedule, allow communities to have their schedules so that persons don't have to come to their member of parliament or go to their local representative and request that the drain be cleaned, because it's not really something that is unparalleled, unprecedented occurrence. It is drain cleaning and grass cutting. And so we have had some response, but the fact that it had to be a response rather than a proactive measure, I think, is really disappointing in 2024.
Yeah. So the Vice Chairman, Henry Awong, he has described Tabaquite as a hot spot area. And again, he has confirmed that Tabaquite has a lot of reported and confirmed dengue cases. He also says, and according to Councillor Balmati Gosain, Tabaquite is just the start as the team, and that is the IVCD team, intends to visit other parts of the region. Do you know if that exercise has begun, where officials of the corporation have started visiting various areas in Tabaquite?
Yeah, so I want to take this opportunity to really commend Vice Chairman Henry Awong. And as soon as the report started coming in, the program was rolled out in the community of Tabaquite. That rollout will continue. One of the challenges we're facing, the Couva Tabaquite Talparo Regional, the Couva Tabaquite Talparo region is quite large. It is a really impossibly big space for us for the local government to manage. And so yes, the rollout has started, but because of the size, the geographic size of the region, by the time you get to, as you cover half, you almost have to double back. And so the Tabaquite region has been covered. The rollout will continue, but we are really hopeful for some additional resources given the size, the geographic size, the nature of the communities involved, the nature of the areas. It really requires some extra thought. It requires some targeted intervention, and it really requires some data from central government so that the local government bodies can know what is the best way to target these responsive measures. Again, if we get the data from central government, from the Ministry of Health, as to where the majority of cases can be are being reported, you then know, okay, this is priority one, and then you move down and you can create some sort of sensible list. But right now, we have to just go area by area and hope that we are treating with the problem in the best possible way.
Yeah, we did speak about the Ministry of Local Government and also the Ministry of Works, but what about, has there been any assistance from the Ministry of Health?
No, not for us as yet. We are also trying to get in touch with our health centers, primary health facilities, to see if they are able to treat with any increased influx of people because of the dengue situation. Once we do have that information, the Office of the Member of Parliament will send correspondence to the Ministry of Health. So we are trying our best to assist, especially in terms of the data gathering from the local government level. I am in touch with the councillors to the central government level so that we can really, again, provide some targets, some areas of priorities. And I will say this though, if something like the mosquito is what is stumping this government at this time, I shudder to think about how we are going to solve major socioeconomic problems, because Again, this does not require rocket science. It just requires proactive, sensible measures done in a timely fashion and executed quickly. Once we have that done, we will be okay. Trinidad and Tobago will be okay. But when we are being reactive and slow and we are withholding the data from the public, what you will get is panic, and so you'll get calls. Every member of parliament, I'm sure, is being called constantly for requests for spraying, etc. And that response is understandable because it comes from a space of panic because we're not given the information in a timely fashion. And I think if we correct that, we'll correct the course on this dengue crisis that we're facing.
What's the next step by you as MP and also by officials at the corporation?
Right, so my next step is to stay in close contact with our local government representatives, because we get a certain amount of information as the MP's office, they get a certain amount of information as local government bodies. My intention is to continue to send information through to the Ministry of Health and hope that they use that in their data mapping, and that we can see a more proactive, targeted, solution-oriented approach to treating with this dengue problem.
Yeah. MP, it's always a pleasure to see you and speak with you. Thank you very much for the update this morning. It is appreciated.
Thank you so much for having me. Thank you for giving me the opportunity to speak on our community and what we're facing. So I wish everybody a safe week and a very good day.
All right. Bye for now, MP.